Now, a recent study on the coronavirus patients shows that patients may still have the virus even if the symptoms were to disappear. Researchers have now claimed that half of the patients that they treated for mild COVID-19 infections still had the virus for almost up to 8 days, even after the symptoms had disappeared. Now, this explains as to why controlling the spread of this pandemic has been so difficult. The study was published in the American Journal of Respiratory and Critical Care Medicine. It assessed about 16 patients with COVID-19 infections who were treated and then subsequently released from a hospital in Beijing between the 28th of January and the 9th of February 2020. Now, one of the researchers included an Indian origin scientist called Lokesh Sharma from Yale University. Lokesh, now, and also Lokesh joins us now in terms of what is happening in terms of the research that has been conducted. Now, Lokesh, let me begin by asking you, what were the 3 most significant findings of this study?
So our research show that most of the people who have the coronavirus, they have very mild infections if they are young and do not have any other diseases. Second most important finding is, even though they do not have severe infections, and even after they resolve their infection in terms of symptoms, they can still have persistent viral load in their nose. That means they can still infect other people. And the third interesting finding that we have published in a different study, that many of these people who have coronavirus do not even get symptoms, but when we check their antibody response, we can see that they had infections previously. So half of the people we are seeing, they may never had symptoms but had the virus inside them.
You know, also, Lokesh, you've been looking at the infection, so please explain to us as to why controlling the spread of these infections has been so difficult, and how does this study, which says that patients may still have symptoms, can be harder to control this pandemic. What does it explain about the response that the world has shown to this pandemic so far?
So this study says that patients may not have the symptoms, but may have the virus. And that's the point. That's why it's difficult to control. Because if you have a person who have absolutely no symptoms and still have the virus, so that particular person can still infect people without even knowing. So that's one of the key point that is being a difficult situation for people, like who is infected and who is not. So that's one of the most difficult part of this disease, and that's a major limitation in controlling the spread.
Now, one of the things that has been noticed is that, you know, one aspect is to try and prevent the spread of this infection. The other is the frontline healthcare workers who themselves are getting infected. So how should we, at this point of time, go about protecting the healthcare workers themselves from the subclinical coronavirus infections?
So we have been highlighting this issue of protecting healthcare workers. We published this study in, not study, it was more like a correspondence, and we wanted to highlight this issue because healthcare workers are the most vulnerable population, and the best way to protect them is to treat every single patient as suspected case. So maintain the social distancing, use proper personal protective equipments like N95 mask, use eye protection, use like complete body suits if available, and try to have, currently in America, we are doing most of the hospital visits on phone. So if you do not have any severe issue, you should just talk on phone and try to not meet the doctor.
And also, at this point of time, India is presently under a 21-period lockdown. This has been done to ensure that the infections do not spread, so that people actually practice social distancing. What is your take on the steps that have been taken by India in preventing the spread of the COVID-19 infections?
I mean, India has controlled really well so far, or I think that may be a false sense because India has conducted really absolutely low number of tests so far compared to other countries. So it may be that there are fewer infection in India, but it is also possible that there are many, many more infection, but since nobody is really testing,
Right.
so they won't know. So to control it, I think the only thing that works is limitation in limiting the travel and social contacts. I think that's the only effective way until the vaccine comes.
All right, that of course is something which the Indian government will have to look at. Thank you very much indeed, Lokesh Sharma, for joining us and getting us all those insights in terms of how the world and of course India should go about in preventing the spread of the COVID-19 infections.